Adolescents often perform as well as adults on cognitive reasoning tests. However, their health-related choices, from substance use to diet, frequently contradict that reasoning. This suggests a disconnect between what a teenager understands and what they actually feel during the moment of decision. This behavior is explained by the dual process model. It posits that information is processed through two systems: an analytic, evidence-based route and an intuitive, affective route. During puberty, these systems develop at different rates. The reward-seeking dopaminergic pathways mature quickly, while the prefrontal cognitive control system, the part that curbs impulses, does not reach full maturity until the early 20s. This developmental gap forces adolescents to rely more heavily on immediate feeling states. In high-stakes situations, they prioritize gut-level reactions over long-term rational calculation. Consequently, public health programs centered on statistical risk often struggle. They target a rational system that is frequently bypassed by the adolescent brain's emotional state. Identifying how to bridge this gap requires looking at how these feeling states actually function. Researchers Sandra Schneider and Christine Caffrey conducted an empirical study to track the emotional triggers behind these choices. Their study assessed 250 late adolescent females, measuring specific emotional motivators against their daily health behaviors. The researchers analyzed these choices across two primary axes: health-threatening behaviors like smoking and drinking, and health-enhancing behaviors like exercise and diet. Crucially, they categorized participants based on their prior experience with each behavior, allowing them to see how an established habit changes the emotional logic behind the choice. The data suggests that affect is not a static impulse. It functions as a heuristic that changes its focus as a person gains more experience with the behavior. This explains why the same emotional warning that stops a novice might have no effect on an experienced user. The first area of focus was health-threatening behaviors, specifically the decision to smoke cigarettes or drink alcohol. For those with little to no experience, the data shows a clear emotional pattern. These high white bars indicate that anticipatory regret, the fear of harming their future or disappointing others, is their primary motivator to abstain. For these novices, the intuitive association with a risky behavior is negative. The mere thought of the behavior triggers an emotional warning. In the high-experienced group, the black bars show a significant decline. For those who smoke or drink regularly, anticipatory regret has largely lost its influence. Instead, their decisions are driven by immediate emotional promoters. Relieving stress or having a good time becomes the dominant feeling. This suggests that once a risky behavior is initiated without immediate negative consequences, the reported intensity of regret diminishes. The psychological focus shifts from potential long-term harm to immediate emotional relief. As a result, the internal warning system that protected the adolescent as a novice becomes increasingly quiet as they gain experience. We see a different pattern when looking at health-enhancing behaviors, such as exercise and healthy eating. On this chart, the white and black bars follow a similar trajectory. Whether an experienced athlete or a novice, the driving emotions are largely the same. While regret plays a small role, the strongest motivators are related to self-esteem and efficacy. Wanting to feel attractive and confident scores highest across both groups. Experience in healthy behaviors doesn't introduce new emotional categories. It amplifies the existing feelings of confidence and efficacy. This suggests that strengthening a healthy habit is less about finding a new reason to start and more about increasing the emotional intensity of the adolescent's existing sense of efficacy. Deeper in the data, the researchers found a critical anomaly regarding how negative emotions impact our choices. They found that an emotion's effect can actually be bidirectional. This chart tracks how sadness and stress impact the desire to exercise or eat well. For novices, the high white bars show these emotions act as deterrents. However, for the high experience group, the effect reverses. The black bars show that stress and sadness stop being barriers and instead become promoters. Experienced individuals have learned to use healthy behaviors as a way to cope with negative states. For them, feeling stressed is the very thing that triggers the desire to exercise. The behavioral outcome of an emotion isn't fixed. Experience dictates whether a feeling acts as a barrier to healthy behavior or the catalyst for it. We can organize these findings into a model that explains how experience dictates health decisions across adolescence. Regarding risky behaviors, Novices are deterred by anticipatory regret, while experienced teens are motivated by immediate emotional rewards. Regarding healthy behaviors, stress and sadness initially deter the novice, but eventually become the fuel for the experienced teen, supported by high self-efficacy. This matrix organizes the feedback loop between experience and affect, showing that behavior is often a predictable result of how these emotions are channeled. This helps explain why traditional health education is often ineffective. Facts and long-term consequences rarely influence the intuitive systems that drive in-the-moment adolescent behavior. Successful prevention should focus on establishing intuitive, gist-based warnings before an adolescent's initial exposure to risk. Once a behavior begins without immediate penalty, the data indicates that anticipatory regret is no longer a reliable motivator. For healthy behaviors, the focus should be on building self-efficacy early. We must help adolescents navigate the initial phase where stress and negative emotions act as barriers to healthy choices. The goal is to support them through this period of friction until they gain enough experience for the polarity shift to occur, turning stress from a deterrent into a catalyst for health. To improve adolescent health, we must look beyond rational instruction and align our interventions with the intuitive mechanisms that actually govern their choices.